Welcome to BoxedIn Health, where knowledge and wellness converge, sparking transformative journey to better you. Today we uncover the topic of epistaxis, nosebleed. Epistaxis, commonly known as a nosebleed, occurs when blood is lost from the lining of the nose. The inside of your nose is rich in numerous small blood vessels that help warm and humidify the air you breathe. However, these vessels are close to the inner lining of your nose and can be easily injured or broken when the air passing through your nose is dry and causes irritation to the blood vessels. This irritation often leads to nosebleeds. The combination of dry air and delicate blood vessels on the inner surface of the nose is a frequent cause of nosebleeds. Fortunately, there are uncomplicated measures you can take to manage and prevent them. While nosebleeds can be bothersome, they typically don't pose a serious concern. Epistaxis, or nosebleeds, can affect anyone, and most individuals will experience at least one episode in their lifetime. However, certain groups are more predisposed to nosebleeds, including children aged between 2 and 10, factors such as dry air, colds, allergies, and inserting fingers or objects into their noses increase the likelihood of nosebleeds in children. Adults between 45 and 80 years old, during midlife and in older adults, blood may take longer to clot. Additionally, this age group is more susceptible to conditions like high blood pressure, atherosclerosis, hardening of artery walls, or bleeding disorders. Pregnant individuals, the expansion of blood vessels in the nose during pregnancy exerts extra pressure on the delicate blood vessels in the nasal lining. Individuals on blood-thinning medications, certain medications, such as aspirin and warfarin, can contribute to an increased susceptibility to nosebleeds. Individuals with blood clotting disorders, conditions like hemophilia and von Willebrand disease elevate the risk of experiencing nosebleeds. There are two primary categories of nosebleeds, classified based on the location of the bleeding as described by healthcare professionals. An anterior nosebleed initiates at the front of the nose, specifically on the lower part of the septum, which is the wall dividing the two sides of the nose. The delicate capillaries and small blood vessels in this front area are easily susceptible to breaking and causing bleeding. This type of nosebleed is the most prevalent and generally not a cause for major concern. It is more frequently observed in children and can typically be managed at home. Posterior nosebleed. A posterior nosebleed occurs within the deeper regions of the nose, typically involving bleeding from larger blood vessels situated at the back part of the nose near the throat. This type of nosebleed may lead to significant bleeding, often flowing down the back of the throat. Medical attention is usually necessary promptly for this type of nosebleed. Posterior nosebleeds are more common in adults. In many cases, the only noticeable symptom of a nosebleed is the presence of blood flowing from your nose. However, with a posterior nosebleed, some blood might trickle down the back of your throat and end up in your stomach. This can result in an unpleasant taste at the back of your throat and may induce feelings of nausea. Nosebleeds usually affect a single nostril, but it's possible for both nostrils to be affected simultaneously. The leading cause of nosebleeds is often dry air, typically found in hot, low humidity climates or in environments with heated indoor air. These conditions cause the delicate nasal membrane, the tissue inside your nose, to dry up, leading to it becoming crusty or cracked. This dryness increases the likelihood of bleeding when the nose is rubbed, picked, or blown. Additionally, inserting objects into the nose or sustaining injuries to the nose and/or face may also trigger nosebleeds. Infections, instances like colds, upper respiratory infections, and sinusitis, particularly those accompanied by frequent sneezing, coughing, and nose blowing. Allergies, both allergic and non-allergic rhinitis, inflammation of the nasal lining. Blood-thinning medications, including drugs like aspirin, non-steroidal anti-inflammatory drugs, NSAIDs, warfarin, and others. Recreational drugs, such as cocaine and other substances inhaled through the nose. Chemical irritants, exposure to chemicals in cleaning products, workplace chemical fumes, and strong odors. High altitudes, where the air is thinner, low in oxygen, and drier due to increased altitude. Deviated septum, an abnormal shape of the wall separating the two sides of the nose. Nasal sprays, frequent use of nasal sprays and medications to address nasal congestion, itchiness, or runniness. These medications, including antihistamines and decongestants, can dry out the nasal membranes. Less common causes of nosebleeds encompass alcohol consumption, bleeding disorders like hemophilia or von Willebrand disease, high blood pressure, atherosclerosis, previous facial or nasal surgery, nasal tumors, nasal polyps, immune thrombocytopenia, leukemia, hereditary hemorrhagic telangiectasia, pregnancy. When you consult a healthcare professional for a nosebleed, they will inquire about specific details regarding the nosebleed, such as how long the nosebleed lasted, in minutes, an estimation of the amount of blood lost, the frequency of nosebleeds, whether the bleeding affected one or both nostrils. Additionally, they will gather information about any medications you are currently taking, including over-the-counter blood-thinning drugs like aspirin, as well as medications for colds and allergies. Your family medical history, particularly regarding any instances of blood disorders. Your use of alcohol and/or recreational drugs that involve inhaling substances through the nose. Following this, the healthcare provider will conduct an examination of your nose to identify the source of the bleeding and potential causes. This examination involves using a small speculum to keep the nostril open, aided by various light sources or an endoscope, a lighted scope, to visualize the nasal passages. To manage the nosebleed, the provider may apply topical medications to anesthetize the nasal lining and narrow blood vessels. They may also remove clots and crusts from the inside of your nose, which might be uncomfortable but not painful. In some cases, the healthcare provider might request X-rays, a CT scan, or blood tests to assess potential bleeding disorders, anomalies in blood vessels, or the presence of nasal tumors. Here are steps to manage a nosebleed at home. Sit upright and lean your body and head slightly forward to prevent blood from flowing down your throat, which could cause nausea, vomiting, or diarrhea. Avoid laying flat or putting your head between your legs. Breathe through your mouth. Use a tissue or a damp washcloth to catch the blood. Pinch together the soft part of your nose with your thumb and index finger against the hard bony ridge forming the bridge of your nose. Ensure you are pinching the soft part against the hard bony ridge for effective pressure to stop the bleeding. Maintain continuous pressure by pinching your nose for at least 5 minutes. Check if the bleeding has stopped. If not, continue pinching for another 10 minutes. Optional, ice pack. Optionally, apply an ice pack to the bridge of your nose to help narrow blood vessels and slow down the bleeding, providing some comfort. Decongestant spray, if needed. If necessary, spray an over-the-counter decongestant spray into the bleeding side of your nose, then apply pressure. Post-bleeding care. After the bleeding stops, avoid bending over, straining, lifting heavy objects, blowing, or rubbing your nose for several days. Regarding medical treatment for nosebleeds, it depends on the cause and may involve nasal packing, inserting gauze, nasal sponges, or an inflatable latex balloon into the nose to apply pressure at the bleed site. The material may be left in place for 24 to 48 hours. Applying a chemical substance, like silver nitrate, or heat energy, electrocautery, to seal the bleeding blood vessel, usually after numbing the inside of the nose with a local anesthetic. Medication adjustments or prescriptions. Modifying or stopping blood-thinning medications and prescribing medications to control blood pressure or promote blood clotting. Foreign body removal. Surgery. Performing surgical repair for a broken nose or correction of a deviated septum, septoplasty, if that's the cause of the nosebleed. Tying off the bleeding blood vessel to halt the bleeding. Here are steps to maintain nasal health and prevent nosebleeds. Apply a saline nasal spray or drops 2 to 3 times a day in each nostril to keep nasal passages moist. You can buy these over the counter or make your own solution by mixing 1 teaspoon of salt in 1 quart of boiled and cooled tap water. Introduce a humidifier to your furnace or use one in your bedroom to add moisture to the air. Gently apply water-soluble nasal gels or ointments, Vaseline, inside your nostrils using a cotton swab. Do not insert the swab more than 1/4 inch into your nose. Nasal care techniques. Avoid forceful nose blowing and sneeze through an open mouth, using a tissue or your elbow to cover your mouth when sneezing. Refrain from inserting any solid objects, including fingers, into your nose. Medication caution. Limit the use of medications that may increase bleeding, such as aspirin and ibuprofen. Adjustments in prescribed medications like warfarin and nonsteroidal anti-inflammatory drugs, NSAIDs, should be made only under the supervision of your healthcare provider. Monitor allergy symptoms. Seek medical attention if you struggle to manage nasal allergy symptoms with over-the-counter or prescription medications. Follow usage directions for over-the-counter products to avoid overuse, which can lead to nosebleeds. Quit smoking. Wear appropriate headgear during activities that could risk injury to your face and nose. Keep your child's fingernails short to reduce the risk of nasal irritation or injury. If you enjoyed today's video, don't forget to like, share and subscribe for more informative content like this. Thanks for watching. See you again with another video.